watch afterwards. They were unable to make it. And actually, for the very beginning, I think I will unmute, because there are a few questions at the beginning I want you to respond with. So I think at the moment you should be able to see, let's see, do you see the slideshow right now?
Yes.
Excellent. So we're going to have a bone and joint seminar. What are some of the common challenges that people have with bones and joints? Anybody?
Obviously. It's obviously connected because you were able to reboot it.
Oh, I think Charlie is.
Maybe there was a faulty connection.
Oh, let me find Charlie here. All right, I got to come back here. We're definitely going to mute Charlie here.
Review.
All right.
All right, I muted myself.
You got it? All right. Okay. So, folks, what are some of the common bone and joint health issues?
Arthritis.
Arthritis. So the joints themselves are having a hard time move. And then arthritis can be anywhere. It can be any joint in the body. And the sad part is that some people think they just have arthritis in their knee, or they just have arthritis in their wrist or elbow or shoulder or whatever it may be. But really, they're developing arthritis throughout their body. That's just the place where they feel it to begin with. What are some of the other bone and joint health issues that people experience?
Osteoporosis.
Osteoporosis. So a thinning of the bones, if you will, and a less stable structure for those bones. What other challenges?
Fractures.
Fractures. And, that you can get fractures when it comes to, just putting too much stress on the body, but you can also get fractures because of that osteoporosis and osteopenia condition, where things are beginning to thin down. And a lot of people who actually have fractures in their older age, it's not because they fall. They're actually just walking along and their bone breaks, and then they fall because their bone has broken. And the mortality rate is actually quite high for people in those scenarios, because the bones have a hard time healing. What are other bone and joint health issues people have?
Pain.
Pain. They hurt. They hurt a bunch. And let me go back here for a moment to this slide on the screen. We have broken bones we're seeing here, and you see this white crown on the edge of the bone here for the hip. It represents cartilage. And we're supposed to have this cushioned material in our joints. But when that cartilage wears down, breaks down, becomes thinner, and people become bone on bone, they hurt. And it can be arthritis that's dealing with that. It can be bone on bone issues, but there's a lot of discomfort that can come with it. Now, suffice it to say, and again, folks, I'm going to mute everybody at this point. If you want to ask a question, please feel free to unmute and ask the question during the presentation. I'm just going to work on getting rid of some of the background noise right now. So can everybody hear me still? Go ahead, okay, I see some nods. Excellent. So we're gonna dive headlong into this presentation. You may want to take some notes. You're going to find yourself saying, man, there's a lot of people that need to see this, a lot of people that need to hear this information. One of the best things that I've got is we have access to a website called bonejointhealth.info. bonejointhealth.info. One last time, that's bonejointhealth.info, where you can send people who are wanting a basic overview of the concepts here. People go to try medications to take care of their bone or joint health issues. And the challenge is that many of the medications are just loaded, and I do mean loaded, with side effects. My brother, when he remarried, his wife, she lost her first husband when he was in his 40s. He went to the doc to get a physical. Happened to mention he had some stiffness in his hands. The doc said, oh, we just got some samples in of a new medication. And 4 months later, his heart stopped ticking. Never started again. It took 10 years for them to take that medication off the shelf. But how we all know somebody who's had bone or joint health issues. And we look to find ways to mediate that. And a lot of people are trying to find ways that don't involve the drugs and the surgery. So your skeletal system, it is incredibly important for your long-term health and well-being. Most people just think of their skeletal system as something that holds their body up. But as you notice in this article here, your bones actually play a major role in the overall health of your entire body. They're not just sticks that hold you up. And I'm going to try to illuminate just how that is and how important that is. Function number one that most of us readily think of when it comes to our bones is we're all pretty much aware that when it comes to our bones, they are I went one too far ahead. They allow us to shake, rattle, and roll. They allow us to be able to move and dance, and we all like movement. We prefer movement that doesn't hurt. And so our bones and joints are really important for movement that doesn't hurt. And incidentally, this technology also affects inflammation. So the muscles that sometimes people have cramps in and things like that, we can have some huge changes there. Your bones are a shield, a protection, an armor, if you will. So your brain protected by an armor of bone, your liver, your kidneys, your lungs, your heart, all of those types of things, all protected by this armor. Your spinal column protected by an armor of bone. And when it comes to what most of us think about, these two items, movement and protection, are what we think our bones do. But our bones go way beyond that. Our bones are a manufacturing facility, much similar to how many organs produce things or have major benefits that they give to the body. Well, most people don't think about our bones are the source of life. Our red blood cells are produced in the bones. And I've actually had people who've been told they've had genetic blood disorders that when they use the technology we're going to talk about tonight, in fact, I'll just show you, for those who are not familiar with it, let me open the screen here for a minute. I'm going to introduce you to what we call the Bone Health Pack. So it's made up of three main things. This is the taxi cab to get things through the gut. It's called Lactoferrin. This is the taxi cab to get things into the bone. And this is my daughter's teddy bear. And this is what's being transported. We call it caldence. This is a calcium. If you take it by itself, might as well not take it. Same with any calcium you're going to buy anywhere. They're finding that calcium in and of itself is not solving the problems. We need to have the taxi cabs to get it where it needs to go. So anyway, we had a gentleman out of Florida who had learned about this technology and Dr. Naidu's research. And what he did was he thought, well, what if my rare genetic blood disorder isn't a blood disorder at all? What if it has to do with my bones? And so he got on this product, and within 2 months, all of his blood work went to normal. Now, another item produced in your bones is are your body's white blood cells. And white blood cells are your immune system, the key things that fight disease. And a lot of people think, oh, if I want to help my immune system, I help my gut, or I need, we hear a lot about antioxidants and a lot of things we can do to help our body fight disease, but the primary agent for disease fighting is our white blood cells, and it is produced in your bones. Now, have you ever heard of someone was anemic, lacking red blood cells, and their doctor said, oh, we need to work on your bone health metabolism to fix your blood? No. And the reason we've never heard that is because we've never had a technology up to this point that could do anything for bone health metabolism. White blood cells. Have you ever heard of a doctor saying, hey, if we want to improve your immune system, we need to work on your bone health metabolism? And up to this point, nope, you've never heard that, because we've never had a technology that could do anything for your bone health metabolism until now. So I've had people that have had problems with white blood cell count, the red blood cell count, the health of the red blood cells, all those things. We get them on this bone health pack, we just see some really neat benefits that take place there. Now, this next slide is really quite intriguing to me. Your bones are actually a chemical bank, okay? Your bones are a chemical bank. And I want you to think about when it comes to a bank, we go to the bank to make deposits. And if the bank is still open a week from now, a month from now, or a year from now, then we will make a withdrawal. So what I'm going to draw here really quick is just your local neighborhood bank. And we use banks on a regular basis to make deposits and withdrawals. Well, I want you to pretend that there's a Frenchman who wants to do business in America. What does the Frenchman need to do business? He's got to have some what? He's got something to spend. He's got to have some money. Fair enough? Got to have money. Well, in France, the money used to be called francs, now euros. You can't spend that money in the USA. First, he has to get in his little taxi cab and drive himself over to the bank where he will make a deposit. And later on, he can make a withdrawal and this time have the money in a different form. So instead of being in euros, it'll be in US dollars. And that form of money is something that can be recognized in this metabolism known as the USA. So now I want you to think about calcium. Your body does not know what to do with calcium. First, it is taken in and deposited into what? Your body must deposit the calcium into your bone bank. And later on, your body can then withdraw it so that it can be spent in this metabolism known as our body. And what does the body use it for? What does your body spend bone calcium on? Again, what does your body spend bone calcium on? And this was really enlightening to me as I began to learn about this concept. Do you guys give me a thumbs up, Seema, if you see the slide with the knee on it again? Okay, fabulous. So your body actually spends 50 to 100 milligrams of bone calcium every single day. It makes a withdrawal from your bones, not from your dietary calcium. Your body doesn't know what to do with dietary calcium. It must first go to the bone bank where it can then be released with certain metabolic markers and then spent. But your body uses 50 to 100 milligrams of bone calcium every single day just so you can think. Your body also uses 50 to 100 milligrams of bone calcium every day just so your heart can tick. I had a buddy out of Peoria, Illinois. He turned 40, and actually he was 42, and he had 2 children and found out that he had atrial fibrillation. He was extremely nervous because his father passed away at age 45 from that condition. And so in a conversation, he asked me, hey, do you have anything we can do for this? And you know, I'd heard of one experience up to that point where someone got onto our bone health pack and atrial fibrillation went away. And I said, you know, I don't know. I don't know if this will help in your situation, but bone calcium is used in every muscle contraction, and your heart uses a bunch. And sure enough, we got him on the bone health pack and no more problems with atrial fibrillation. Your liver, your kidneys require bone calcium every single day. Your digestive tract, 600 to 800 milligrams of bone calcium required every single day just to make your digestive tract function. And it's interesting to me the number of people that have bone health issues that, as a byproduct, also have digestive issues. Muscle contraction. Every single muscle contraction and nerve impulse requires bone calcium in order to make it function. So let's move ahead a little bit. We're going to talk about right here some basic facts. You get 10 sets of bones in the average lifetime. Average person will get 10 sets of bones. Someone comes in at midnight, cuts you open, pulls out the old bones, puts some new ones in. It doesn't work quite like that. Your body actually is in a constant state of remodeling. And we'll illuminate how that works. But the interesting part here, if you'll notice, you get 5 sets of bones before the age of 20. Well, if 5 sets of bones are used before the age of 20, how many are left after that? Just 5 more. Well, up to age 20, you're getting bones every 4 years. After that, it's taking over sometimes 10 years to get a new set of bones. Wouldn't it be neat? Wouldn't it be neat if there was a technology that could speed that up and make it like you were 20 again? All in favor, say aye. That's a really neat concept. We'll elucidate how that works. So we're going to introduce some characters to a play here for you. This top picture shows these little purple guys. They have a fancy name called Osteoclasts. I'm just going to call them Pac-Man. Munch, 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 munch. Coming along and eating at the old brittle parts of your bone. Well, the pharmaceutical companies would like to tell you that he's a bad guy, that we don't want him eating away at your bone. They say if we can kill Pac-Man off, then you will retain more bone. But there's a problem with that. Pac-Man doesn't just eat. If you look at the second slide, it shows that Pac-Man actually eats and distributes. So that's how your body gives metabolized calcium for your brain and your heart and your liver and your kidneys. Just a whole series of benefits that can come there. There's actually some interesting research. I don't know how many of you know people that are diabetic. Think, if you will, of people that you know that are struggling with that not so fun condition. I have an article right here, actually out of Oxford University, Columbia University, big difference there. Professor Gerard Carcenti, and he was doing research on a substance that's released from the bones called osteocalcin. And osteocalcin released from the bones, they found actually stimulates the pancreas to produce more insulin. And it made all the other cells more sensitive to the insulin that was produced. So in effect, reversing, in the mice that were studied, the effects of type 2 diabetes. It also helped in prevention of obesity, all those types of things. We've actually had, I'd say, roughly 50% of the people that I know that have diabetic issues who've gotten on the Bone Health Pack that have either dramatically reduced their medication or completely gotten off. So it's not a fix for everybody, but it is kind of interesting a side effect, a good effect. So I need you to remember this first character, Pac-Man, his job is to eat, munch, 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 and distribute. The next character we're introducing, I call Surfer Dude. And Surfer Dude just sails along the smooth surface of the bone, enjoying the ride until it finds a divot. When he finds a divot, he calls all of his buddies over and says, hey guys, let's build some new bone. And that's how your body is able to identify places that may be weak and need new bone to be built. That's that remodeling process we're talking about here. So slides or pictures 1 and 2 are supposed to balance out with pictures 3 and 4, but people with osteoporosis start eating away too fast and not building up fast enough. In fact, that building process slows down a whole bunch. So what are the stats? We have now 12 million Americans with osteoporosis, known to have osteoporosis. A lot more do, but that's what we know. 40 million Americans with osteopenia. So here's normal bone health, and then osteopenia, they're starting to thin, and really bad is osteoporosis. They're both the same condition. It's just a measurement of the degree of severity. If you have osteopenia, you are at risk of fracture. 66 million Americans, in addition to that, have arthritis. It's a big deal. 66 million Americans that are arthritic. That added up together is 118 million Americans. That's over a third of our population that right here, right now, as we speak, know that they have bone or joint health issues and they're actively looking for a solution. And they're scared to death, many of them, of the side effects that come from the traditionally prescribed medication, especially the bisphosphonates, Fosamax, Boniva, Actonel, Reclast, Forteo. In fact, right here, I've got a picture of, it says an important correction from Boniva. You heard Sally Fields for years advertising Boniva and all of its amazing benefits. In here it says Boniva has not been proven to stop or reverse bone loss in 9 out of 10 women and is not a cure for postmenopausal osteoporosis. They actually had to go through, and they're still prescribed, but they've in fact, I've got a binder here with piles and piles of, lawsuits that have gone up against these bisphosphonate drugs. Well, it doesn't solve the problem to get rid of the drug. We still have to find a solution. If you notice in the bottom of the chart, it shows that our teenage youth are having challenges. Picture on the left, a very thin slice of healthy bone. Picture in the middle, same thin slice from somebody who has osteopenia. And the picture on the right, same thin slice, but obviously a lot less bone found in someone with osteoporosis. They're actually finding osteoporosis in our teenagers now. Why in the world would we be finding osteoporosis in our teenagers? Well, some people say it's because of their diet. Some people say it's because of lack of activity or lack of sunshine or soda pop. You may have heard of the importance of maintaining proper pH balance. Proper pH balance. So if the body is too acidic, which is the lower numbers in the pH scale, you're more prone to cancer, stroke, heart disease, diabetes, all that type of stuff. Your blood is supposed to be, 7 is neutral, and your blood is supposed to be 7.365, a very narrow level of tolerance. If your blood goes down to 7.36, 7.2, hospitalized, 7.1, you're dead. And your body will do anything it can to balance out the pH in the bloodstream. So how does this work when our young teenager, and of course nobody on the presentation tonight would ever be guilty of this, okay? You're all exempt. But once in a while you may find a young person who would go to a store and buy a nice tall can. I wish they'd label it properly instead of giving it all these fancy sweet sounding names, but a nice tall can of phosphoric acid. So they take their soda enhanced phosphoric acid and they glug, 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 glug. And everything's okay for about 10 minutes till it gets into the bloodstream. And as it hits the bloodstream, remember that 7.365 pH, it starts to drop. And your body begins to freak out. Help! The blood's going, red alert, acid attack, we're in trouble. pH is dropping. If it goes to 7.3, you're sick. 7.2, hospitalized. 7.1, you're dead. So what does the body do to balance out this terrible can of phosphoric acid? It goes and grabs the most plentiful alkaline mineral it can find, known as calcium, found in your bones. Grabs from there, puts it in the bloodstream. You may have heard of calcium called a buffer before. And pH comes back up, 7.365, everything's temporarily okay. Challenge is our teenage youth are not just taking in 1 soda a day. And you go back 50, 60 years ago, many people would report that they got a soda once a week, once a month. It was a rarity, a very small treat. And now some people just think it's a normal thing to have one with every meal. And that's just one of the many things that are causing challenges. And osteoporosis, the bone density of our youth is now 25% less than just one generation before. So interesting things happening in that category. So here's a picture of a skeleton in the top left, tall, erect, full height. And as osteoporosis sets in, they begin to lose height, sometimes a lot of height. I met a gal out of Monterey when I gave a bone seminar she came up to me and she says, I'm 45 and I've lost 10 inches. And she came up to my chest right here and I was like, whoa. She'd lost 10 inches, she said, in the last 5 years. Well, if you notice the skeleton, here is a bunch of vertebrae underneath the rib cage that goes down to the pelvis. But on the right-hand side, that vertebrae is gone. People actually have compression fractures where the vertebrae are all stacked on top of each other, and the vertebrae in the middle, it just disappears, ka-chink. And that can cause a loss of height. It can cause challenges with impinged nerves. And the real issue there isn't just pain, but the brain is supposed to send nerve signals down the spine into the gut, and the gut will send nerve signals back so that you can communicate, find out what's going on. But if those nerves get pinched and your organs aren't communicating well with the brain and vice versa, function decreases. And people end up with a whole bunch of challenges that go along with that. So, at this point, I want you to think, you've seen the people who literally, instead of being tall and erect, they're completely bent over at the waist and just kind of hobbling along. That's not the time to begin thinking about your bones. Ben Franklin said an ounce of prevention is worth a pound of cure, more like a ton of cure. In the prevention industry, they found that that literally $1 spent in prevention, this is according to the World Health Organization, is worth over $15 of after-the-fact treatment. So in real dollars, we'll say you could choose to spend $10,000 to be well, or you will be compelled to spend over $150,000 to maintain your sickness. $10,000 to be well, or $150,000 to maintain your sickness. You know that when you sit and think about it, it goes, well, maybe I should do some things to keep myself well. And those who spend some good time and realize that your health is one of your most valuable assets benefit extensively long term. Some men say, oh, I don't have to worry about osteoporosis. That's a woman's disease. It's not. 1 in 4 men now with osteoporosis, it's more likely to have osteoporosis than end up with prostate cancer, let alone all the challenges that men have with arthritis, typically more abusive on their joints than the women are. So just some big challenges there. Some people say, well, I'm going to solve this problem. I'm going to go get calcium. Calcium supplements, the most widely used supplement out there. Yet we take more calcium supplements than any other nation in the world, and yet we still lead the world in degenerative bone disease. Are calcium supplements fixing the problem? No. So then people say, well, I'm going to get my greens. I'm going to have lots of vegetables. Well, I've done bone scans on vegetarian groups, and I've often found their bones to be not as good as other folks. Vegetables, you get some calcium, but you're not going to get all that you need. Milk. People say, I'm going to get my milk. Milk does a body good. Milk builds strong bones. I mean, we've heard this for a long time. But who told us that? It was the American Dairy Association. They want to sell milk. And we consume now more dairy than any other nation in the world per capita. Our people get more dairy than anywhere else in the world, and yet we lead the world in degenerative bone disease. Is milk solving the problem? No. So we'll get fortified foods. We're going to add calcium to our orange juice. We're going to add extra calcium to our milk. We're going to add calcium to our cereals and supplements. It's not helping. And the problem is in absorption. It doesn't get where it needs to go. And it often ends up in the wrong places. In fact, you may know people that get kidney stones. You may know of people that have hardening of the arteries and high blood pressure. In fact, a lot of high blood pressure medication is calcium channel blockers. I'll talk briefly about this. I really don't care how wonderful your calcium formula is. It's not solving the problem. We can go back 40 years and people started taking calcium, and then 5 years later someone said, well, calcium's not going to do any good. You need calcium and magnesium. And then they said, no, you need calcium, magnesium, and phosphorus. And a couple of years later they said, well, that brand's got the ratios off. You need calcium and magnesium and phosphorus in these ratios. And then they said, well, no, you need you need microcrystalline calcium, or you need calcium citrate, or they said you need calcium with boron, or you need coral calcium, or I mean, we can go on and on and on with the calcium stories that we have heard over the decades, and they're not solving the problem. Most recently, we've heard about vitamin D. And here's, according to the Annals of Internal Medicine, recent research is showing that supplementation with vitamin D and calcium for the prevention of fractures it's just not doing it. It's not fixing it for women. People are going to the drugs. And Consumer Reports is even weighing in now. I thought Consumer Reports was going to tell people about washing machines and cars, and you know, I didn't know they were in the drug industry now. But they say that the benefits of bisphosphonate drugs do not appear to outweigh the risks of fractures. People are more likely to get fractures when they have the drugs than without. So kind of interesting thing. So let's talk for a minute about the risks people have with bisphosphonate drugs. This first one, jaw decay. This blew my mind away. I came across an article by Alan Bavley of the Kansas City Star. And there was a gal named Geneva Grimpo. She'd fallen and broken her arm, and so the doctors put her on drugs for her bones. And she had a plate of bone replaced in her jaw, only to find out a year later that all the bone around that rotted out. And then she had more jaw rotting out on the other side. She could literally take her finger in through her skin and pick out bits of bone. And it went on to say that they interviewed Brett Ferguson, the chairman of oral surgery at the University of Kansas, Missouri, City School of Medicine and Dentistry. And he said that they've had an explosion, not a few, an explosion of patients with problems. In fact, your dentist now will no longer work on you if you're on one of these drugs, because they're worried about literally your jaw coming off of your face. Geneva Grimpo, she had to be fed with feeding tubes. Another gal, they were pulling teeth and the whole roof of her mouth came off. It's called Osteonecrosis. And it's most prevalent in the jaw, but it can happen shoulders, hips, whatever. But it happens with people who are on these drugs. So the next one you see on there, it says disabling pain. Not severe pain, worse than that, disabling pain. Difficulty swallowing, heartburn. But it's okay if you have heartburn because we can give you a drug, right? The drug's going to fix your heartburn, right? No. The drug will cover up the heartburn, and you have ongoing inflammation in the esophagus, which then leads to esophageal cancer. If you don't believe it, just Google Fosamax plus esophageal cancer, or Boniva plus esophageal cancer. Numbness, mental irritability. But it's okay if your drug makes you mentally irritable, because they'll give you another drug, which may make you suicidal, but at least you'll be happy doing it. You look at the side effects of these drugs, it's really kind of crazy. Seizures. Oh, we can get a drug for that. Anemia. Oh, we can give you another drug for that. Blood clotting problems, skin rashes, severe constipation. Oh, we've got more drugs for that. You get on one drug, and 3 to 5 years later, you're on 3 to 5 more drugs. So I put in the bottom of the slide, it says, not everything that is free is worth the cost. Well, what are the costs? Now you see them on the page there. I ask you, if the drug lord came to your 14-year-old and offered him his first dose of heroin for free, is it worth the cost? And I would submit that, and probably many of you would say, hey, if we could find something natural to fix the problem and not have all the side effects, that'd be a good thing, okay? So, and I hope all of you have had dinner already. This is a picture of what they call osteonecrosis. I don't think, personally, I don't think dentures are going to fix this. This is pretty bad stuff, folks. Notice the gums are gone. Here's some more pictures of the same thing. The second bone seminar I gave in southern Idaho, and the gal came up, she was in the second row, and she said, this is real. She said, look at my mouth. And it's rotting away. And so if you ask me any drug that is going to do this to your bones, I see that if it's doing that to your jaw, that it's going to be helping the rest of the bones in your body. Here's prednisone, a very popular drug for people with arthritis and so forth. Makes people aggressive, more likely to have heart failure, vomiting, thinning of the skin, hair in all the wrong places, rattled breathing. I mean, it's dangerous stuff. Typically lowers people's lifespans by about 10 years. It can cause some real serious rashes, skin problems, all that type of stuff. Humira, nasty drug. I've met a gal that her daughter had come down with lupus because of taking it. Lots of challenges. So those who listen to this bone seminar, some are looking for things for their joints, some are looking for bone density. We're going to try to cover all those things. And the good news is our technology is safe. It comes from you, from a world-renowned research and development company, in-house research, development, distribution, 40-plus years of absolutely amazing technologies comprised in creating what we call a wellness home. And the opposite of a wellness home is a sick home. And the more of our technologies you get, the healthier a place your home is, all the way from your water to your air to your sleep to all those types of things. So with that in mind, we're going to share a couple tips, if you will. There are some things you can do for your bones. Be active. Weight-bearing activity, good for your bones. Avoid medications. Every medication, well, I should say 99% of them, 99% of all the medications that you take are actually acidic. So some people say, well, I'm really healthy and I don't take soda pop and I'm health conscious and therefore I'm going to be okay. But every one of those pills you pop from your pharmacist is like taking a nice tall glass of phosphoric acid in terms of the amount of calcium it withdraws from your bones. Worst ones are heart medications, inhalers, asthma, cancer. Terrible chemotherapy does for bones. Weight issues. Can you be too heavy, folks? Well, yeah, we can be too heavy. In fact, every excess pound above is major challenge for our lower joints. And some people get really frustrated with their weight, can't get rid of it, do a surgery. And then because of the lap bands and so forth, they become what they call bariatric patients. They don't absorb. They do not absorb. And in fact, I met one gal, her doc said that she was so far behind in calcium after her surgery, they had her on 4,000 units of calcium a day, and she still was not absorbing calcium. We got her on this bone health pack, transformed her life. Well, the opposite of, you may not be aware of this, but bariatric patients, the ones that go through these stomach surgeries, they're finding roughly 5 years after that the small bones of their body, and their hands and their feet, are turned to like pretzels, just really easy to break and snap. On the other picture you see here is someone really skinny. Can you be too skinny? Hollywood would say no. But we found that sometimes people are skinny because they're not giving themselves enough nourishment. Sometimes people are too skinny because maybe their stomach is not absorbing things well. But the other issue is that if there's not enough weight to make weight-bearing activity for your bones aren't going to grow as much. Soy, bad for the bones. Acidic lifestyles, bad for the bones. Age, bad for the bones, is what your medical world will tell you. And to all of this, I'm going to say hogwash. Now, understand that there's wisdom in avoiding your medicines and having good weight and having good physical activity, all that type of stuff, but it's not going to solve the problem. Had a gal, she was 35 years old. She had 8 kids, cooked all the meals from scratch. Her mother she felt died from over 20 medications she was taking a day. So she would not touch a medication. She, any rate, was very active, had done marathons, all that type of stuff. Age 35, she had 5 fractures. So even though she was keeping to this list, there's still a problem. Well, what's that problem? Do you remember the Frenchman that wants to go do business in America? In order to get to the bank, he had to have a taxi cab, a transport mechanism to get the money to the bank, the calcium to the bones. When you are 20, you have all the taxi cabs you need. By the time you're 60, this taxicab protein transport molecule known as lactoferrin, you have 1 in 5 taxicabs still in business. We're depleted in that category. Joint health. Some tips for joint health. Watch your weight, hydrate, exercise, posture, sleep. Sleep is huge for joint health. Nutrition. Nikan has some amazing technologies in these categories. If you know people that are just worried about joint issues, get them on our sleep systems, our far infrared wraps, our joint nutritional, our CM cream, and our water. My mother, arthritic, 10 years with the problems, nigh onto a wheelchair. These technologies transformed her life. Now, she put magnets everywhere. She had the little magnetic chips. She had the necklaces, the insoles, the sleep system, everything. But in 6 months, she was off a decade of medicine, okay? And the other thing is that these can help with a whole host of other problems. What I want to do now is transfer the remainder of this presentation to just the bone health pack because of its amazing benefits with inflammation and bone regrowth. The bone health pack, as I mentioned before, made up of 3 main things. By the way, if you're on this, the one on the left, Lactoferrin in the orange box, like sunrise is in the morning, you take it in the morning. The other 2 are darker. You take those in the latter half of the day or in the evening. So the Lactoferrin on the left is the gut taxicab. The Osteodenx is the bone taxicab to get things into and out of the bone. And the Caldense is what we want to be transported. Yes, we have to have calcium. But by the way, you do not need the megadose on calcium. If someone's telling you need 2,000 or 3,000 milligrams of calcium, you don't. What you need are the taxicabs. Okay, moving ahead. Where does this come to us from? Is this just some cute idea that someone has that we're going to fix? No, this comes from over 30 plus years worth of research and development from a gentleman who's actually really big in the pharmaceutical world. He's now founded 5 now successful biotech companies. The slide needs to be updated. Major inroads in toxic shock syndrome in the 1980s. Dr. Naren Naidu was the guy that solved the challenge we had in the beef industry with E. coli. To this day, if you eat beef, it has been treated now with a natural antimicrobial protein molecule known as lactoferrin. He spent 30 years of research of this molecule. And because it's not a drug, he hasn't formed a biotech company out of this puppy and made a pharmaceutical out of it. This is a natural thing, but what he was able to do is to isolate it and to be able to get it back to us. He's been twice nominated for a Nobel Prize, knighted by the Queen of England. Just pretty amazing, amazing man. Osteodenx, patented transport system. Folks, I use this. I had an autoimmune condition. I also use it not only for rebuilding that, but I also use it because this is a chelation, a natural chelation for the bones. And I was exposed to lots of toxins in the farm, sprays and all that type of stuff growing up. If I've got something that can help get rid of that toxicity, that's a good thing. This is a system designed for the joint or the synovial area. So we literally have people who were bone on bone, who couldn't go up and down stairs, who couldn't do deep knee bends and get up again, who can now. Huge transformations there. So you see on this slide here, someone with a lot of pink cartilage here, and then here there's no pink. Well, how would you like to find pink again? There's a lot of people that would like to have that stuff restored, and we're seeing some amazing benefits in that category. One thing that happened is in the research, they found that this was stimulating chondrocyte cells, which is what actually produced the cartilage. This technology actually now has a counterpart that Naidu has introduced called Bonio. We do not distribute this product, but it is the same technology with a delivery system specific for dogs. And they have you see the orange pill on the left there, which is a maintenance formula, and the blue pill box, which is a clinical formula. So if someone has a broken bone, they give them they give the dog the clinical formula, the double dose, so to speak, until they're built back up, and then they keep them on the maintenance formula. Osteoporosis, bone breaking, same thing. I actually had one of the neat things they've been able to do is because they can actually do studies on animals they can't do on people. They can take the dogs and feed them the exact same food. All the dogs got the exact same nutrients. And they could isolate them and make sure that they didn't move. And they actually proved that this technology had over a 33% increase rate for fracture healing. That's huge. It's all the rave in the veterinarian world. The first study on our technology, the Osteodenx, our taxi cabs in America, was done with a group of women, postmenopausal women, who were having bone challenges. Half the group they simply put on calcium, and the other half they put with calcium and taxi cabs. And the group that had calcium and taxi cabs, this chart shows that if you remember Pac-Man and Surfer Dude, it lowered how fast Pac-Man was eating away at the bone. It didn't kill it. It didn't stop it. It just lowered it to a normal rate like when you were 20. And this slide is what everybody is incredibly jealous of. Nobody else can do what this does, period. Nobody else can do what this does, and that is increase the cells that are building new bone. Now, there is one other drug out there that is helping with Surfer Dude, not as much as we're helping with Surfer Dude, and all the rats that were on the drug, well, they were getting cancer in their 18th month, so they're only giving the drug to people for 12 months now. But I prefer something natural without side effects and 3 times more effective. So, by the way, all these studies I can get to you. There's boatloads of studies here. This came out of Osteoporosis International. This is the one that turned my head. This is where all the big drugs want to get published. The study showed that this produced new capillaries. It promoted bone formation in a major way. It restored Pac-Man and Surfer Dude to the same levels of production as when you were 20 years old, and it did it within 6 months. And when you're 20 years old, you got new bones every 4 years. How many of you know people that like a whole new set of bones and joints within 4 years? Would that be a cool thing? I mean, that's huge. And this last one, we didn't talk about up front. Your bones not only produce red blood cells and white blood cells, but your bones also are a manufacturing facility for stem cells. And those stem cells can be directed or differentiated to become many different things in your body. Your stem cells have the coding to become liver tissue or muscle tissue or nerve tissue or brain tissue or heart tissue. So wouldn't it be cool to have a technology that is actually helping to direct and facilitate that? In fact, if you will, your body's own natural fountain of youth. How many of you want your body's fountain of youth functioning optimally? It's a big, big deal. This next study is a huge, this is published in Inflammation Research, May 2010. Understand that every disease out there deals with inflammation. And in this study, the blue chart here shows things in your blood that fight inflammation. The red items on the graph are the things that cause inflammation in your blood. And what they were able to do is establish that this technology, this bone health pack, literally elevated the things that fight inflammation in your body by 140%. 140%. Now, for those of you that have things that hurt in your muscles and your joints, this is huge news. Reduction of inflammation. One of the fastest responses I heard was a gal, she hadn't been able to hold her husband's hand in 10 years. 1 week on this product, and she was able to, no problems, good grip, hold, I mean, just huge things. This also decreased the things that were causing the inflammation. This is only the beginning of the studies that were there. I could go on all night, and I'll show a couple other things in terms of digestive and antimicrobial studies, but you can go on PubMed, you can Google lactoferrin and fertility, lactoferrin and Lactoferrin and Candida, Lactoferrin. I mean, we can go on and on and on with the benefits. We have our product as 6 patents, protects us, 18 years, nobody else can use it. This is the only place that you'll get it. Now, we have 2 lactoferrins. Naidu's research found that there were 29 different types of lactoferrin in the body. So let me outline this real quick. Lacto means milk, ferrin means iron. And the first studies of this, the first believed use was that this was something that helped the body absorb iron. But then they found out it wasn't a stimulant. It was a smart molecule. It was a regulatory molecule, not something that artificially stimulated or suppressed reactions, but something that was like a thermostat to bring heat or bring cool whenever we needed it. So lactoferrin helped with iron, but they also then found out it was helping your body absorb trace minerals. If you've ever done any study of that, trace minerals are huge for your long-term health and well-being. They found out that there were 29 different forms, a different lactoferrin for every major system of the body. A separate lactoferrin for the brain, a different type of lactoferrin for your heart, one for your bones, lactoferrin for your gut. It was an intercellular communicator. So it's a very, very interesting molecule. They've now found places where your body produces a little of it. We also get it from milk. Our source is from cows in New Zealand, where there's no challenge with mad cow disease or anything like that. If you're lactose intolerant, no problem. This has none of the things in it that people are intolerant to. I've yet to have anybody who has had any type of allergic reaction with this. It is a natural antibacterial, antifungal, antiviral, antiparasitic. And let me see if I can pull out a couple of these things. I'll switch the screen here for just a moment so you can see a couple of these. And again, if you would like to have copies of these, just let me know. Here's lactoferrin as an antibiotic in cases of salmonella. Here is, this is the Osteoporosis International study. Here is lactoferrin as an antimicrobial formulation. I mean, I love it. Folks, I haven't had, good grief. I'm trying to think if any of our kids have. Our kids don't even know who our doctor is. I haven't had an antibiotic. I really can't remember in how long, because this stuff is a natural antibiotic. Lactoferrin and colitis. Huge studies with inflammatory bowel diseases. This one has lactoferrin and gut health, lactoferrin and cancer. This is Naidu, produced in the Italian journal. This is lactoferrin and candida. Here's the original study that was done for bone health. This is lactoferrin and inflammation response, and the study that's gone on with it. Here is, it's just, we've got a ton. I mean, there's a ton. And this technology is amazing with the types of responses people get. Let me go back to the presentation here and wrap up this particular slide. Lactoferrin is also now required in not only China, but Japan, because of what it's doing. They found lactoferrin in the colostrum and in mother's milk is huge for the body's development of its defense mechanisms. Elimination and naturalization of toxic compounds, free radicals, maintaining regularity will tenfold increase the value and effect of antioxidants in your body. Fertility. Listen very closely to this, because some of you may have family members that have spent tens of thousands of dollars on fertility treatments. Naidu did lots of research with lactoferrin and fertility. They found lactoferrin everywhere, including on the head of the sperm. No lactoferrin on the head of the sperm. The sperm do not get to their destination because it's a communication molecule. Lactoferrin throughout the vaginal fluid, lactoferrin throughout the spinal column, all that stuff. If you give 2 of the lactoferrin to the man, 4 to the woman, I've yet to have someone who has not found the ability, that was not able to get pregnant, that are now. I mean, it is huge benefits. I'm sure we'll find some, but all the way from endometriosis to all sorts of challenges, we're seeing huge benefits with this technology. Here's a picture of a mouse on the top, mouse bone, very frail, very thin, very little marrow activity. And if you look at the lower picture, 13 days with our technology and lots more bone and lots more marrow. I'll share a story of a gal in Hawaii who had twice been asked to be the donor for a bone marrow transplant for her sister. She was called up a third time. She went into the doctor to get a core sample to find out if she was still capable of being a healthy donor as she was getting older. And the doctor wigged out. He says, "What in the world are you doing?" She said, "What do you mean?" He says, "I know your bone health. We have baseline from the 2 times before that we've done this procedure with you, and you had been aging normally." He says, "But you are now in your latter years, and your bones, you now have the bone marrow of a healthy teenager." She'd been on our bone health pack for just 3 months. This is a chart that says you can try calcium and vitamin D or glucosamine or isoflavones or drugs or hormones and get spotty results. Or you can try the bone health pack that helps with just about everything that you're worried about with bones and joints. So, what do you like about what you hear? I like it's natural. I like it's safe. I like it's effective. Hey, she's waving at you. She's waving at you. You want to wave back? I like it's natural, safe, effective, and let me share a couple stories. Hockey player up in upstate New York had been hit in the mouth in his younger years. Later on, found out that he had dental problems that were due to having been hit with a hockey stick, etc. Told he couldn't have surgery because his bones were not good, and they were wanting to put him on drugs. He said, "No, I've learned about this other stuff. I want to try the bone health pack." Showed the dentist or the doctor or the surgeon the results from this stuff. He said, "Go give it a try." And instead of having to be on a drug for 2 years before he could have the surgery, he was on this for 6 months, and dramatic improvements. Another story, I got my mother invited her neighbor to come to one of my bone health seminars. This gal walked out of my presentation somewhere between 6 and 10 times. I thought she was upset at me for some reason. I didn't know what had happened. It was a room full of people, but she had come in and would leave, somewhat distraught. She said, "I had no idea that these drugs the doctors had me on were causing so many of my other problems." And we got her on the bone health pack. And not only did she have bone health benefits, but she had gotten to the point where not only she had depression, she was bipolar, and that leveled out. And massive constipation issues went away. She was extremely elated with the results of this product. Another gal, in fact, the same lady I told you that she could hold her husband's hand after 10 days. After a month, she just felt like her brain was clear. She said, "I'm sleeping better, my brain's clear." And she mentioned to her daughter that she says it felt like her short-term memory was coming back. And her daughter said, "What did you say?" She said, "Well, my short-term memory, it's like I can remember things better. I don't, go down to the pantry to pick something up and forget what I was there to pick up as much as I was before." And the daughter said, "Do you think this could help Connor?" Connor was the grandson. Connor had not passed first grade because he couldn't read. And he did first grade a second time, still couldn't read at the first grade level, but they moved him on because social issues. Into second grade, still could not read at the first grade level. Into third grade, could not read at the first grade level. The mother is a teacher. It's not a lack of help here. Fourth grade, they've got him in special Sylvan learning methods. He's got C's, D's, and F's in all of his classes. It's January 1st when the phone call came and Grandma mentioned that her short-term memory was doing better. They ordered the stuff, and second week of January, the grandson gets on it. And reason he gets on it is because he was told that Grandma was taking this stuff so she could run faster. and he didn't want grandma running faster than him. Mom had other reasons, but that's what they told him. He was diligent at taking it. Within 6 weeks, the teachers were calling home saying, "What are you doing?" A 6-month period, he went from all C's, D's, and F's to all A's, B's, and a C. This was the only thing that changed. His reading went through the roof. So can bones affect our brain? I don't know if this was coincidence. I don't believe it was, because we've seen other people having some really great things happen too. But just some really cool stuff taking place with it. Next thing that let me go back to that story. The grandfather was intrigued that his wife could move her hands, and he had some hand problems, and he got on the product, and not only did his hand problems go away, but he had performance issues in the bedroom for 10 years. And those were no longer issues for him. I asked in a group in San Francisco, because they'll talk about anything, I said, anybody else reporting the same results? And there were 5 gentlemen who raised their hands and said, yeah, it's fabulous. So I'm not saying it's a cure-all for everybody, but pretty amazing. There's a lot of people who are worried about that kind of thing. Now, the big story, though, was the long-term result for the grandmother. She had lupus. She had arthritis. She had osteoporosis. 6 months of being on the bone pack, and she no longer hurt. Not just in her hands, but anywhere. She went to her doctor and said, I don't think I need any more medications. And he said, oh, you'll need medications. She said, I want off. He said, you'll be back within 6 months, guaranteed. 6 months, she didn't show. And he asked her to come in for tests. No discomfort. The blood work showed that there was no sign of the disease. He said, I have never in my history of my practice ever released a patient unless it was to the grave or to another doctor that had your conditions. He said, your blood work doesn't even show those conditions anymore. So this product is amazing. My own mother, 10.4% increase of bone density in under 6 months. Now understand that a 4% increase of bone density after 2 years is about the best they can hope for with Fosamax. And they say you can't get any benefits after 70. Well, my mom had a 10.4% increase, and she was over 70. I've now had a gal in her late 80s. She had a 28% increase of bone density in 6 months. So here's the story. It used to be $173. You can now get it for $103.50. Just sign up as a registered customer. We can get it coming your way. And that's a boatload cheaper than all the meds. I met one gal, she was, this is hard for me to believe, but she was spending over $4,000 a month on her bone medication. Now, a lot of people will find themselves at $200 or $300 or $400 for these others. Some of them you can get for as little as $75, but they all have their side effects. Well, with this particular product, you can get on auto ship, a monthly shipment, and just get it for $77. Well, would you rather pay $173 or $77? All in favor of $77. Give a hip roaring aye. So the bone health pack is just huge. I want to talk a minute about dosage, and this is really important, so tune in. The bone health pack is a maintenance dose. So after you've had a problem and you fixed it, and you want to maintain good health instead of falling back into bad health, you are on the maintenance dose. Well, if you've fallen off the cliff of bone or joint health and you want to get back up the ladder, it's going to take, all the studies were done with 2 of the Osteodenx pills a day. Okay? So what that means is if you have osteopenia, you order the bone pack plus one more of the Osteodenx. If you have major arthritis, you do the same thing. If you have osteoporosis, you're really in trouble. You're going to be on 3. I've even seen some people do as many as 4. But you're going to want to get on at least 3 of the Osteodenx a day. Okay? Each of the blue boxes come with 1 pill per day per month. Okay? So 1 box, good for a month, 1 pill a day. You should be on 3 a day if you have osteoporosis, 2 a day if you have osteopenia. And then once we get you from osteoporosis up to osteopenia up to normal bone health, stay on just the maintenance dose to keep from falling back down. You need enough taxi cabs to keep things moving. So that's the basis of this. There's a whole other part of this presentation that deals with the fact that there's a major financial opportunity that's involved here too. Nobody else has this, folks. Everybody needs this. I feel like we have a moral obligation to let everybody know what this technology is and how it works and how awesome it is. It's fun sharing it. People are grateful for it. But then Nikan says, hey, we share movies all the time. We never get paid for it. We share books we read all the time. You never get paid for it. But this is something you can share, and Nikan will reward you. Some people say, well, I want to get my stuff for free. Well, if you get 4 customers on the Bone Health Pack, you essentially will be able to get yours for free. All in favor of free as a good cost, say aye. That's a good thing. And then other people say, you know what? I know a lot of people that could benefit from this in a, not a minor way, but in a major way. And as such, I wouldn't mind making an extra couple hundred or a couple thousand, or good grief, why not 20,000 in a month? I know that sounds crazy, but we have people that do that with this. So I'm going to unmute everybody. Your lines are all unmuted right now. And if anybody has any type of question of any nature, I'd be happy to answer those. Any questions? Everyone is mute. Oh, now I hear you. Any questions or comments or anything you'd like to share? Yes, Shirley.
Ron has diabetes, so should he be on an iron pack, or just Lactoferrin, or?
So the people that I've had results with diabetes, they seem to have been done fine with just their standard Bone Health Pack.
The whole pack.
Yeah, the Bone Health Pack, yes. And again,
also, I have atrial fibrillation, but I've had that for 40 years or 50 years, whatever. When I was a child. So, but they have me on, I forget what the medications are. There's just a couple of them. However, how does this, you mentioned something about AFib earlier?
yeah.
Medications you are on with that?
I've had multiple people who've been able to get off their AFib meds. So, you know, magnets themselves make a kind of a natural blood thinner. We also have the benefits that, for whatever reason, for some people at least, AFib seems to be caused by a lack of calcium getting back to the muscles and nerves. And the heart is a really important muscle. And if we restore that, I can't guarantee, I mean, there's no guarantee everybody's body is different. But I've had a boatload of people report that they've had some wonderful results that way.
Could you mention a little bit?
Sorry, go ahead.
You'd be on maintenance formula then for that?
Just off the top of my head, I would say half the people that had the response were on the maintenance dose. The other half were people who were trying to address other problems and just noticed it as a side benefit.
Yeah.
Yeah.
Could you comment on somebody that has some arthritis, and what causes that, and what would be good for your arthritis?
Well, there's multiple types of arthritis out there. Many of them deal with inflammation. And that can be inflammation in the cartilage, it can be other inflammation in the joint area and so forth. Because of the anti-inflammatory properties of this, we've seen many people with a multitude of inflammatory conditions, including arthritic challenges, having phenomenal results. So many people getting into our wellness home, our sleep systems and all that, having results as well. I mean, when you sleep is when your body naturally is supposed to deal with a lot of the inflammation issues. But I've seen this product take people over the edge to they just simply don't hurt at all anymore. So, I mean, I'll mention one other thing. You know, I got a guy that's down in St. George, Utah. His wife got on it, and we mentioned some of the stuff about brain health, and she started doing some testing with him. She put him on 4 of the Osteodenx a day. And when he's on 4 Osteodenx a day, he is normal and livable and a joy to be around. When he's not on 4 Osteodenx a day, he is the opposite of that. And again, I don't know if that's calcium transport from the bone to the brain or what it is that's doing that. But I've had people report in that venue too, that it can play a role in mental health. Now, maybe there's getting better sleep that's causing that. I don't know all the reasons, but that's also one that's interesting to note and report. Any other questions or comments?
I have a question.
Seema.
Regarding blood thinner, you said, because Jerry's on Coumadin.
Yeah.
And the magnets are actually natural blood thinner?
Yeah.
That's
So magnets help with viscosity. It's now recent research, 4 years ago, there's a gentleman who was working with oil companies, try to find a way to improve viscosity so they could transport the crude and so forth through the pipelines, and they ended up using magnets for that. Well, they said, well, if magnets do that for the crude, I wonder what it's doing for the blood. So he did some tests and actually found benefits for blood viscosity because of magnets. And so people in those scenarios, I recommend that they get as many magnets on as possible. Necklaces, bracelets, insoles, the back magnet as much as possible, and obviously a sleep system. And be sure to monitor what's happening, if you can, with some blood testing during that time period, because many of them find that they can either reduce or sometimes get off of those blood thinners they've been on.
Great.
So natural things that the magnetics are doing in that category.
And for the Epstein-Barr, because today I noticed more symptoms like when Jerry said, look to your right, and I turned to the left. 2 times I made the mistake with.
So the Epstein-Barr virus, this particular Lactoferrin product is antiviral. And if I were to address Epstein-Barr, you want to build your body, make you become more alkaline that you can. So you and I have talked about the jade green zymes before. This is going to be helpful for the immune system, would likely be helpful for the immune system. The component for Epstein-Barr that I would up a bunch would be the Lactoferrin. Double or triple on that for a period to see if you can get ahead of what's going on with the Epstein-Barr virus. And as you and I talked about before, sleep. Anytime you feel tired, sleep. Your body needs it to be able to recover and rejuvenate. Any other? Dee, hello.
Yeah, hi Brody, how are you?
Very good.
Question on multiple melanoma.
Oh, you guys are giving me the tough ones tonight. So, I do need to make a disclaimer here, folks. I am not a doctor, and we do not cure or treat anything. What I'm sharing with you are the experiences that many people have had, and if it were my family member that had multiple melanoma, we would be on this product in spades immediately. Okay? Extra lactoferrin, extra Osteodenx, no worries in any way, shape, or form. Lots of jade greenzymes. Don't take it just 3 times a day like comes in the jar. Take it 6 to 8 times a day. Alkalize yourself like mad. Lots of Pymag water, alkalize. That's big. Immunity, our immunity mushroom formula. Huge. 7 of the mushrooms in there are known in Eastern medicine for their anti-tumor characteristics. Strangely enough, your 10-4, which a lot of people think of as an energy drink, I prefer to call it a focus product, but there's a lot of research about matcha and green tea for its anti-cancer properties. That would be a big one, obviously a sleep system, and I would put magnets over all affected areas. I would also wear as much far infrared as you can. Go to the black market and buy far infrared long johns for this person. I know people who have sold those things for $200 a pair now. They're amazing. They're amazing. Yeah. Any other questions? Okay. Folks, December is a marvelous time to go share NECAN. People care about their loved ones. They want to give meaningful gifts. They're tired of trinkets. They're tired of stuff. And people care about their loved ones and want to give them the best. It's all in your attitude as to what happens in those categories. I've got appointments happening left and right. People aren't as likely to meet in the evenings, I've found, in December, because they've got band concerts and choir concerts and company parties and all that type of stuff. But I'm readily able to go in and do individual appointments with people, luncheons, whatever, and some evening appointments. But we've got people that are hungry right now. It looks like I've got 3 more seniors on the way this month. So there's just some really great things that can happen when you get out and share. Just share your story from your heart, the things you've seen happen. Share the stories you hear are happening to other people. I mean, that's what we do. Is we're professional storytellers. There have been many people that have been known to be great figures in history, religious figures, people who have been all sorts, and many of our greatest leaders have been nothing but great storytellers. They will teach us through story, and that's one of the best ways to share NECAN. Share stories, share from your heart, and people will want what you have. Well, folks, thank you a bunch.
Good night.
Well, everyone have a great night, and Shirley, I'll see if I can get you a link for this, so if you want to pass it on to people, you can.
Oh, yes. Thank you, Brody. And one of the things I plan to do